Hi, I'm Larry Greenberg, a general pediatrician with a long-time interest in medical education scholarship. This module is entitled Finding Research Ideas from the Workplace and is directed to faculty who have trouble getting a research project underway. The objectives for this module are to describe how the workplace can inform one about research ideas, to recognize how potential collaborators can be recruited based on workshop ideas, to analyze the kinds of questions that emerge, i.e. content versus process, and to identify characteristics of a good workplace question. By the end of the session, you should be able to identify possible research questions and collaborators from your everyday practice. So, how does a research question evolve from your workplace? One way to bring focus to your professional identity and work is to develop a mission statement in 30 words or less that identifies your activities and passions as a clinician educator. This mission statement identifies who you are academically and can certainly change over time. An example would be the following. My passion is to work collaboratively with others to develop excellence in teaching for our division. Using adult learning principles, I strive to understand my learners so as to teach them effectively and efficiently. Besides a mission statement, paying close attention to common threads that you see in your daily communication and social media tools like email, iPhone, Twitter, etc. can generate a research idea. An even more important area is reflecting on how we communicate with patients and trainees, identifying gaps where there isn't evidence. There are two categories of questions that become apparent when considering a question from the workplace, namely, content issues and process issues. An example of content issues would be what do residents know about a patient presenting with syncope, and what criteria would they use as indications for immediate patient referral to a cardiologist. A process question might be, how do we measure how effective resident teaching is in a clerkship? Another way to look at a research question is within what domain does it fall? That is, knowledge, attitudes, or performance and behavior. Of course, there can be overlap between content and process questions as you develop your research question. It is important to assess the characteristics of a good research question. Some workplace ideas can be very big endeavors that would be difficult to study without resources, such as funding and personnel. So think small. Ask yourself if the question is doable in a short time frame. Choosing a more complicated topic that might take months to complete can be a barrier to staying with the project. Any question you choose should be one in which you feel invested and are passionate about. In addition, perhaps the research will be value added to your division in some way. We did a QI study at Children's Hospital to assess the number and kinds of errors on an inpatient diabetic pathway. We found decreased resident errors after a learner-centered intervention as compared to a control group that resulted in improved patient outcomes. One of the barriers to beginning a research project is to do this alone. We are all so busy with our patient care, teaching, and administrative responsibilities that getting started on a project seems daunting and basically undoable. I would suggest that for a project to have a great chance of succeeding, one should seek faculty locally, regionally, and nationally who have like interests. Networking involves from listservs, examining the literature, committee meetings, and proposing a question for a study group in an organization. An example would be a group of clerkship directors combining forces and examining entering medical students' perceptions of patients with chronic illness, tracing these perceptions over time to see if the culture in medical school changes them. In my experience, an untapped group of collaborators can be rising second-year medical students in their summer before their second year begins. They are eager, available, can help collect data, crunch numbers in some instances, and can help write abstracts and even papers. Residents are less available, but also potential collaborators. Thank you for your attention as you went through this module. I hope I have given you some teaching points that will not only help you generate research questions from your workplace, but also inspired you to get started on a project while the learning is fresh. Carpe diem.